Is Loxapine a typical antipsychotic? Have you ever wondered about the different types of medications used to treat schizophrenia? One medication that often comes up is Loxapine, also known by its brand name Loxetane. So, is Loxapine a typical antipsychotic? Let's break it down. Loxapine is classified as a typical antipsychotic, which is also referred to as a first-generation antipsychotic. These medications are primarily used to manage symptoms of schizophrenia, such as hallucinations, delusions, and disordered thinking. The way typical antipsychotics work is by blocking dopamine receptors in the brain. This action helps reduce abnormal excitement and regulate behavior. Now, while Loxapine fits into the category of typical antipsychotics, it has some unique features. In addition to blocking dopamine receptors, Loxapine also affects serotonin receptors, particularly the 5-HT2A receptor. This dual action is more commonly associated with newer medications known as atypical antipsychotics. However, Loxapine is still considered a typical antipsychotic because of its overall profile and the higher risk of movement-related side effects compared to atypical options. When it comes to schizophrenia treatment, Loxapine is available in oral form, which is usually taken once or twice daily. There is also an inhaled powder version for acute agitation in schizophrenia or bipolar disorder. The oral form is used for ongoing management of schizophrenia symptoms. Common side effects of Loxapine include drowsiness, dizziness, blurred vision, and movement disorders like tremors or muscle stiffness. These movement-related side effects are more likely with typical antipsychotics, such as Loxapine, than with atypical antipsychotics. In the context of treating schizophrenia, Loxapine can be a practical option, especially when other medications are not suitable or effective. It is essential to follow a healthcare provider's guidance when using Loxapine, as stopping the medication suddenly can worsen symptoms. The decision to use Loxapine depends on individual needs, side effect profiles, and how well the medication controls symptoms. So, to answer the question, yes, Loxapine is indeed a typical antipsychotic. It is used to treat schizophrenia with a mechanism that involves both dopamine and some serotonin receptor effects. It is part of the first-generation antipsychotic group and serves both ongoing symptom management and acute agitation in schizophrenia.